everyone, it's Dr. Park. I wanted to bring you into a day at North Star Lip and Tongue Tie Center. So today I saw a beautiful 3-week-old baby boy. He was born at 9 pounds, 5 ounces, and mom came in to me. She had seen a lactation consultant and a body worker. Basically the baby was and is growing okay, but she noticed sometimes during the feeds he would fall asleep while eating, and the latch was shallow. He was a really messy eater, lots of gassy fussiness with swallowing a lot of air while he was nursing. So I'm going to bring you along into the exam and then a little bit about what we did today. So here we are examining baby. Today, I make sure that the baby is laying flat, and I'm always above the head, looking from top below with good lighting. And what I'm looking for initially is just any kind of asymmetries. Is the head tilted and favoring one side over the other? Is there, excess use of the muscles of the face or the neck when they're sucking? I look for blisters along the upper lip and the lower lip, as those are signs of compensations or overuse of other parts of his mouth except for besides his tongue. Then I look at the lip. I lift up the lip, looking at that frenum, and baby boy has a very thick and wide upper lip frenum, and it wraps all the way around his gum line, so much so that it's causing that notch in his gums. I look for blanching of the attachment sites. I look at the tongue below. I look at the mobility. Is there, good range of motion? I look at the attachment on the baby. How much can the tongue elevate up to the palate? How much can it stick out over the gums? And then I use my finger to kind of evaluate his suck swallow. I look at, can the tongue hit my finger? Is it weak? Is it chomping? And these are all kind of things that help me understand what is happening on a day-to-day basis. Here is a photo of the baby's upper lip tie. And what you see are my gloved fingers holding up the lip. At the top of the picture is his nose. And what I see is a very thick upper lip tie that attaches his lip down below to his gum line. And there's so much tightness there that it's causing this notching of the bone underneath his gums. Next, we look at the photo of his tongue tie, and the Q-tip is positioned at the tip of the tongue, and it's holding it up. And what I see is what looks like a very thin tongue tie that's located and attaches the mid portion of the underbelly of his tongue to the floor of the mouth. What I also notice here is what we call cupping of the tongue, where the edges of the tongue lift up, but the middle portion of his tongue does not. This is an intake form that I have all moms fill out at the time of the consultation. This is courtesy of Dr. Richard Baxter, who is a pediatric dentist out of Alabama. And basically, it gives me an idea of signs and symptoms that the mom experiences on a daily basis at home, not only for the baby in terms of feeding, but also for herself on her breast on nursing. So here is our patient's intake form. And what I noticed immediately is that the baby showed a weak and shallow latch. There was clicking noises when he was eating. He was very gassy with poor weight gain, and milk dribbled consistently when he was nursing. So I take all the information that I learned from the intake form, from the interview, and then from my own clinical exam, and I put all those pieces together. So for this baby, my assessment of his lip frenum is that it is a thick and wide lip tie. Medical classification is a Cotlow class 4, and the attachment goes from the lip to the incisive papilla, and the tight frenum severely restricts the movement of the upper lip. For his tongue frenum, it is thin and short, and the Cotlow classification is class 3. The attachment
lives from the middle tongue to the floor of the mouth, and this tight frenum restricts the elevation of the tongue, causing a poor latch and a insufficient seal. To set up this little baby boy for continued success in feeding and growth, I recommended a lip and tongue tie release, which we did the same day. Here is a photo of his lip release immediately after his frenectomy. I used my CO2 laser to release those tight fibers to allow his upper lip to move freely. Here is a photo of his tongue immediately after release. And I hope you can appreciate how much more lift the middle of his tongue has after removing the tight frenum. Baby boy did great during his procedure, and after we reviewed the stretches and the release instructions, he was discharged and went home. I saw him back in the office 1 week later, and here is how he did over the week.
Hi, Sarah.
Hi.
And you're 1 week out from our lip and our tongue release for baby Kai.
Yes.
So tell me about what you noticed over the week. Any new findings, anything improved, anything maybe not so much? Just kind of give me a rundown of what you guys have been doing.
So right away I noticed an improvement in the latch. That's been much better both on my end and for him. Like, he's able to pull milk a lot easier. Like, he doesn't feed as long. He doesn't fall asleep as much when he's latched. At the same time, you know, doing the stretches and everything, he'll get sore after that, and so it's a little bit of a battle when I have to latch him after, because, you know, he doesn't want to get on right away. But in general, he's doing really well. He's gaining weight. He's still a little gassy because he'll suck in air once we do the stretches, because, you know, it's sore.
Yes.
But overall, like, he's not getting air when he's nursing.
Huge.
So that is a big difference.
Right.
Because he was just really gassy before, and that has improved, even though he's still getting some from, you know, just the
regular stretches and day to day. Okay. Tell me about kind of what you've noticed in terms of like his sleep, and I know you had a little bit of changes there.
with his sleep, you know, because essentially he like got a new tongue, you know, with everything. So he kind of went back shorter stretches, wanting to not quite cluster feed, but just nurse a little bit more often. So technically went back a little bit because he used to do 3 to 4 hours pretty consistently, which is wonderful. But
we'll get you back there.
Yes, we'll get back to there.
Okay.
But now he's more to the 1.5 to 2 hour stretches at night, which you know, it's just a little different, but still he still sleeps well. Like, his mouth stays closed more consistently. You know, he's not making as many like clicky noises or anything like that, or the occasional snore. So like all of that's quieted down. So.
Great. And you have seen your lactation since you guys left us?
Yes.
Okay, and how?
Yes. She was really impressed with how the latch was going with everything, because like there was a lot more movement when he was nursing, and so, you know, like supply, keeping that on after you regulate, she said that that's going to be really great now, and so it shouldn't be an issue.
Okay.
So
all good news. Okay, great.
All good news.
At this visit, I have Mom fill out a follow-up form and look at what changes she has seen in only 7 days. She has noticed a deeper latch with less clicking and smacking noises. The lip no longer curls under, and baby is fuller and less frustrated after his feeds. I am so happy to see his progress in only a week. I hope you found this video helpful. If you have any questions or comments, feel free to leave them below and share what else you would like to see to make it helpful as you navigate this journey. See you next time. Bye.